Hello, and thank you for tuning in to our live Q&A about mental health in the time of COVID-19. Today, I'm joined by Stacey Pawlak, clinical psychologist at University of Iowa Hospitals and Clinics. Please submit any questions or concerns you have now, and we'll answer as many of them as we can throughout our discussion. Thanks for joining us today, Stacey.
Thanks for allowing me to be here, Elizabeth.
Of course. So this year has been hard. We're living through a global pandemic, protests, social change, unprecedented storm, plus all the usual stressors of daily life. What can we do better to cope with what feels like a constant stream of negativity or change?
Yeah, I mean, this has been just an amazingly difficult year. And I think what I would like people to think about, what I would want everybody to think about is that stress is real and it's okay to acknowledge it. It's okay to feel stressed out. It's okay to be worried about things. When things are changing so frequently and there's so many unknowns, it's normal to have those sorts of feelings of anxiety and stress and sadness and grief. But in acknowledging those things, I also think it's important to remember the positives, to remember the things that are still okay, to not be overwhelmed by the stressors. And I know you're thinking, really? Are there some positives out there? Can you tell me what they are? But what I try to do, what I encourage people to do is really take things one day at a time, one step at a time. And in living in the present, you can remember the positives, like, okay, I'm okay right this moment. I'm breathing. My loved ones are okay. I'm doing okay. So really breaking it down to the very basics will help us to manage the stressors and be okay.
Yeah, that's a great reminder. Do you have any tips for people who might have trouble with, finding the positive because maybe they feel like, but this has been such a hard year. Is it okay that I'm thinking something's positive? It can almost feel hard because you feel bad about finding the positives right now. Do you have any tips for people just, getting over that hump and being like, it's okay?
Yeah, I think not only is it okay, it's vital. It's like someone said something to me recently that I thought was really profound. He said, we need to hunt the good. We need to find the good things in the midst of all these challenges, because that's where the hope lies. I think right now a lot of people are feeling a little bit hopeless about things like, when is this going to end? When are things going to be back to normal? When are we going to be okay? What's upcoming? Because there's so many transitions and changes. And then sometimes when we do feel good about stuff, we worry that maybe I shouldn't feel good. Maybe I should feel miserable. And I don't necessarily think that's the case. I think that some people really have a greater ability to kind of see the good things going on. And some people, it's more of a struggle. We all have different things we're struggling with. So for some people, it's going to be easier to hunt the good. And for others, it is going to be more of a challenge.
I love that phrase, though, and that's going to stick in my brain, and hopefully it'll stick in our audience's brain too. Hunt the good. I love that. So as difficult as this year has been for many people, our resiliency has never been so evident. What makes us resilient, and how do we continue to maintain that resiliency?
I think of resilience as being like able to roll with the punches, able to sort of like make lemonade from lemons, sort of like to bounce back up when we've been knocked down. And I think people are not even aware sometimes of how resilient they can be. We'll see others struggling and making it through challenges, and we'll say, I hear this all the time. They'll say, I couldn't do it. I don't think I could manage that. How could I do that? But if you ask someone who's gone through a trauma or a struggle or a challenge, how did you do it? They'll say, I don't know. I just did it. Basically, they're pulling from things that the skill sets and the strategies that they've used in the past to manage their challenges without even realizing it. So when I meet with people, we're never starting from square one when we're talking about how are you going to face this. It's like, what have you done before in your life? Because this isn't your first day on earth. You've been through challenges. All of us have been. What have you done? Who have you reached out to? What have you, how have you dug down and figured out ways to cope with whatever's coming up? So, and another thing with resilience is it's all about also reaching out to others at the same time. Resilience is usually not a single person job. It is pulling from both our internal resources and the people around us. So that's really important too.
So boundaries can be an important tool in managing our mental health. Would you say that setting boundaries, like limiting how much of the news we watch, as an example, is more important this year?
I definitely think it can be important. And most people can tell when they're starting to feel overwhelmed by information. It's a normal human drive to seek information, to make sense of our circumstances, to understand why things are happening the way they're happening. But what's been going on this year is we don't have a lot of answers. We don't know why this virus is doing what it's doing. We don't have an endpoint to when it's going to be over. And there's so much information floating around that one day it's this thing and the next day it's changed to something else. So the boundary setting becomes important because it's very easy to get overwhelmed with too many pieces of information. And it's really hard to find facts. You see a lot of opinions, and especially like in social media and even just in regular old media, you have a hard time determining what the fact is and what the opinion is, or what's the fact today that changes tomorrow to not a fact. So in setting limits and boundaries in all the information that we take in is important so that we just don't get overwhelmed, that we don't latch onto misinformation and further kind of spread that out and get more confused and confuse others in the process.
Yeah, I know sometimes I find myself like knee deep in information that I'm just like trying to get more and more of, because in a way it gives me like a little bit of a sense of control. But then when I really take a step back, I'm like, this still isn't helping me. It's just, fueling more of my confusion, because like you said, there is just so much information out there. And so what you said just really resonated with me, that, it is good to take that step back and maybe limit some of those things for my own mental health.
Absolutely. Yep.
So if someone has been considering going to therapy, would you recommend starting during this time where, people seem to be struggling a little bit more? Would that be a helpful tool as we continue to live through the pandemic?
I think therapy can be a useful tool at any point, especially during times that are so challenging, multiple stressors going on right now. I haven't yet met a person who hasn't been touched in some way, whether it's themselves or a loved one, because of all the stressors that are currently going on. So the main things you want to think about, is therapy going to be something useful for me? Is there something that's causing you stress? And do you have a willingness to address that thing with another person, to talk about it, to see how you might be able to change it, how you might be able to change how you react or think about it? Some motivation to do some work in treatment. So it's, right now also what's an important thing for people to think about is that telehealth options are available. Prior to the pandemic, it was something we dreamed about. It was something that psychologists and therapists like me wished we could do, and there wasn't good options to be able to do it. There weren't good insurance carriers weren't necessarily paying for it. And we knew it was something good for people. It was a way to connect when you couldn't get in for an appointment, or it wasn't feasible to kind of be there in person. But now this option is available more and more frequently for people, and it's being paid for by insurance carriers most of the time. So it's even more of a bridge into treatment, I think, for people who maybe might find it hard to leave their home. They're fearful of the virus, or maybe they're very far distance from their provider. Right now, I'm seeing people that I never could have seen before for therapy, and it's a very powerful tool, and I'm so excited to be able to do it because we have telehealth options. So I think that's another thing people need to think about, that it may have been a hindrance before, like they couldn't get in or whatever, it wasn't covered to do it that way, but now it is.
That's a great reminder. That is one of the goods of this situation, is that now that is an option for people.
Absolutely.
So with social distancing, it can be harder to know when someone we love is having a hard time because we're not seeing each other as often and we can't see those physical cues of stress or anxiety. Do you have any tips for knowing when we should check on friends and family right now?
Yeah, that's a really important sort of point, is being able to check on people, especially with social distancing and quarantining, things like that. We don't have the usual avenues to sort of reach out and see people. And and kind of interestingly, one of the markers of sort of someone maybe struggling is social withdrawal, not kind of reaching out. So unfortunately, because of social distancing and challenges in reaching out, and us reaching out to others, that's sort of like it's even a greater challenge to sort of find that. But we can find ways to reach out to other people. We can find ways to connect. We can text, we can call, even if we can't sort of stop by, just checking on people and saying, hey, what's up? I haven't heard from you. So that's a really big thing to look for, is just not hearing from people. It's a red flag when someone that you ordinarily spend, have some interaction with or spend time with is not available, or maybe the tone of their communication has changed as well. Maybe there's a sense of hopelessness there, or just an overwhelm. Like, I don't know how I'm going to manage this. I don't know what I'm going to do. Those are red flag, verbal kind of red flags that we want to think about. And just, sometimes it's not sadness, sometimes it's anger or anxiety. Grief is huge right now. That's something that we want to keep a lookout for. And grief, that in PTSD as well, those are things that people don't always kind of see in an everyday life. So frequently anyways. So those are things to look out for as well in our loved ones. And all the usual things like tearfulness and not eating right, not sleeping. It's harder to pull these things out during, the current times because of the pandemic, but be persistent is what I say. Keep trying, keep reaching out to friends and family, arrange regular meetings so that if it's missed, you realize it's being missed. It's not just like, oh, I thought I'd check in, but every week at this certain time, I'm going to check in with you. And then when that person isn't there, it's a huge red flag that something's up.
Right. Those are great tips. Thank you so much. So if you're just joining us, we're here with Stacey Pawlak, clinical psychologist at UI Hospitals and Clinics, answering your questions about managing your mental health during the pandemic. Leave any questions or concerns you have in the comments below, and we'll get to as many of them as we can. We do have a question that came in from someone watching on YouTube. And Jack is wondering, how common is depression? And can you talk about how common depression is in our area and nationally?
Yeah, so Jack, that's a really good question. I'll tell you right now, like some of the stats with currently with depression. I can't give you the specific numbers right off the top of my head, but there's been some recent articles out there where they've been studying the changes in both depression and anxiety during the pandemic. And the numbers are pretty frightening right now. And there's not necessarily a big difference. I'm trying to remember, there was some stats on Iowa now, and I can't remember what it was. I think we're sort of about the same as the national averages, but around a quarter to a third of people right now in our nation, adults, are experiencing depression and anxiety symptoms. And that's double, sometimes even triple of what we're normally seeing. So there's significant change. That's a very significant increase in depression and in anxiety symptoms. And I don't think this is something that's going to change anytime soon. That's one of the biggest problems that I think mental health care providers are thinking about now, is not only the short-term impacts that you're dealing with in terms of mental health consequences, but the long-term impacts. There's financial concerns, there are political issues going on, there are, of course, health issues. And so these things aren't going to go away anytime soon. So that's the real concern with the levels of depression and anxiety. Iowans, I think, tend to be a sort of more resilient folk. We tend to, maybe we don't talk about our troubles as much. We kind of, try and manage them ourselves. But I think all of us are we're seeing numbers that are common across the board, across the country, in increases.
So if someone finds themselves experiencing symptoms of depression, what advice do you give them?
Yeah, so if you yourself are feeling depressed, the biggest, most important thing you can do is to reach out. And like we've been saying, it's more challenging right now because of social distancing, but there's going to be ways to do it. And there definitely are even if you don't have loved ones or someone nearby or a friend or someone that you can talk with, sometimes it's actually easier to talk to someone you don't know. There are some really good support options locally and also nationally. There's some different chat options, warm lines, hotlines, crisis lines. And it doesn't have to be when you feel like, if you're feeling like you might hurt yourself. That, of course, is something that you want to reach out if you feel that. But even if you just need someone to talk to, I've even recommended these to my therapy clients who can't reach me maybe on the weekend. They're not going to be able to reach me. So I'll say, make sure you give this place a call. Like NAMI has warm lines, Community, which is local in Iowa City. Foundation 2 is another one. These are places where you can reach out and connect with others. So of course, if you have family or friends, that might be your first option, but these other options are really good ones. And they're 24 hour, a lot of them are 24 hours a day. So you don't have to worry about the time or if someone's busy with something and you don't want to bother them.
Thanks for providing those resources and tips. That's so helpful. So Valerie on Facebook is wondering about the needs of seniors who are high risk for COVID, and so they're socially distancing. Do you have any advice for how best to meet the needs of our, family or friends who are seniors and have to really be strict about quarantining?
Right. Yeah. So they've really got double the challenge from a lot of, compared to a lot of us right now because of the increased health risks that they're facing. So social support, can be accessed through social distancing, which we've already talked about as well. In addition, mental health is not just based upon just social support is a big piece of it, but you also want to be just engaging in the things that are meaningful to you in addition to, seeking social support. So things like getting enough rest, eating, engaging in activities that are pleasurable. So when I work with people, we'll try and come up with a list of as many possible things we can think of that are stress reduction strategies, relaxation strategies, pleasurable activities. And yes, some of these things are limited during pandemic times when we can't maybe get outside and do something, or we can't go to the movies or go out to dinner or something like that. But jigsaw puzzles, man, you can do those by yourself if you want. I've been doing that. Pets are good. So seniors, who are maybe more homebound or inside, books, movies, things that take your mind away from your stressors for a little bit of time, a pleasurable distraction in some way. So in addition to the social support, if it's hard to access that, just remembering the things that normally draw your attention, hobbies, stuff like that, that make you feel a little bit more normal.
Yeah, you reminded me, I know not everybody is tech savvy, but if we can help people get connected for virtual stuff, I have a good friend that we have been doing regular virtual coffee dates. So we both get coffee from wherever we like coffee from, and we both sit at our respective homes and we FaceTime and we just have a conversation just like we would normally at the coffee shop. Mm-hmm. But safely and following social distancing guidelines. So if there's a way to set up, grandma or grandpa with that kind of technology, then maybe that's another way that they can keep that sense of normalcy with their kids or their grandkids or whoever.
Absolutely. I think that's a really good option too. And I am not good with tech, but I've been able to figure out a lot of stuff. And sometimes my kids have to help me. But, there definitely are good options to do that. And people are having get-togethers in that way. Families are having get-togethers. Friends are having get-togethers. And certainly it's not the same, but it is definitely something that's worthwhile trying. It's a connection, a different way to connect, but a positive way.
Absolutely. And like you said, the sense of normalcy just can't be downplayed, I don't think. It just, if it gives you a little sense of, oh, this is what we would have normally done, just
Right.
virtually this time, it really does help.
Absolutely. No, my son is going to a virtual birthday party this weekend, so
That's
Twister.
fun. That's
I'm not sure how Twister's going to work, but
please report back to us and let us know how that goes. So my next question is about parents and kids. So parents and kids alike may be struggling to balance their emotions right now. Do you have any advice for managing fear, anger, sadness, grief? I know you already mentioned grief is a big one. For parents and for kids, like how can I help my daughter, but also how can I help myself so that I can be a better mom during this time?
Absolutely. Yeah, I think that kids, at the beginning of the pandemic, sort of thought it was kind of interesting and maybe fun, depending on how old they were and how much they were engaged in activities or school or whatever. It felt like maybe this is something interesting and new. And it's really worn on all of us, including our kids, and with school and just sporting and activities and other things, are whatever it was that they were engaged with in their world. Most kids now, there's something that's been impacted, that they used to do and enjoy that now they can't do or isn't the same. And being a parent, and you're managing your own stress, your work life, your health, your concerns for the world, and then you're trying to help your kids manage that as well. So it's very challenging, especially with a lot of people having to do virtual schooling now, and it just adds a ton of sort of extra burden onto what we're already coping with. I think that our children look to us as role models and examples of how they should think and behave. And so it's okay as parents to show some stress, to say, I'm worried, I'm not sure what the answer is to this, or I'm not sure when this will end. It's not, problematic to do that. It lets our kids know that they can feel that way too. They can be concerned. We certainly don't want to be, really fearful and telling them we're terrified and it's scary, because they're going to feel that too. But letting them know it's okay to be wondering, like, how is this going to end? What's going to happen? And then, helping them to learn some of the same skills that we use. Back when school was sort of kind of still going on before the summer, the schools were sending out packets of study stuff, but they also were sending out some really neat materials on calming strategies. And I loved them. There were some ones that like deep breathing exercises and progressive muscle relaxation and just positive visualization, things like that. So a lot of mindfulness and just really nice calming strategies that kids can use. And I was using some of my kids' strategies. I thought they were really great. So the same kinds of stuff that we as adults are going to use to calm ourselves, the basic self-care, those are going to be the same sorts of things. And helping our kids to reach out to their friends and their grandparents and even their teachers. That's another one too, that kids really miss, I think, being with their teachers and stuff, those important adults in their life beyond their parents and their family members. So helping our kids to connect with others, that's what we need to be doing as well.
Thanks. Those are some great reminders and tips. So if I've heard many people say, I just want this year to be over, or I just want to find a new planet. This one's too much. Yep. And this sentiment is understandable. I think most people can understand it. But is there a way that we can try to reframe our thinking so we're not so focused on the negatives? I know we already talked about trying to hunt the good, but do you have any strategies or tips for how we can try to reframe that thinking?
Yeah, absolutely. And I mean, I hear some version of those phrases just about every day, and sometimes it's out of my own mouth. So I think that when we feel overwhelmed, when circumstances don't make sense, when we've been coping with those overwhelming, unable to understand circumstances for a length of time, we want to escape. We want to get away. We'll do whatever we can to end it. And with what's going on right now with so many different situations in our world, the end point is not apparent. So what I want people to remember, what I want to think about, what I think about is that sometimes it's during the most challenging times when we actually learn the most. It tests us and challenges us in ways that we're not really, it doesn't feel so good when we're in the midst of it. But then after, it's like, wow, I really grew, or I figured something out about myself. So it's normal to want to escape, but I think sometimes in staying present in the circumstances, in the challenges, we actually grow and learn and adapt in really important, positive ways. And like I mentioned before, when I talk to people about reach down into, the previous challenges that you've dealt with to pull out the skills that you have, we are developing, I think right now, all sorts of skill sets that we never had before. We're definitely pulling from the past, but we are also growing and learning and figuring out stuff that we will carry with us, into the future, and we'll be able to use with future challenges too. So I think that's an important thing for people to remember. And gosh, I wish we could escape. Vacation is just not something that's going on right now.
Oh, we had a few that we were like, we could do XYZ safely, and then something else would happen that prevented us from being able to do it. And so my husband and I have finally just given up on that thought. But yeah, we're doing other things, little day trips and stuff that we can just kind of get away for a day at least and feel like this is what we would normally be doing during the fall or whatever.
Absolutely. Yeah. It's all adapting to new. So for sure.
So I know you've already mentioned a little bit that, the things we're learning right now could potentially help us when we face other challenges in the future, the skills that we're learning and how we're coping. Aside from that, do you have any advice on how to mentally prepare ourselves for anything else that may happen this year?
Yeah, I think that's a good question too, because, I think at the beginning of the year, and even when the pandemic started, we kind of thought, well, this is going to be it. It'll be over at a certain point. Then things will go back to normal and everything will be good. And then the next thing hit and the next thing hit. And then that last thing kept going. So I think it's important not necessarily to sort of live like in anticipatory worry, like what could be on the horizon and it's probably going to be horrible. But it's a good thing to engage in preventive strategies, things that will boost you up. So not necessarily being afraid of what's to come, but how can I strengthen myself in case something does come along? How can I maintain positive functioning and good health and good mood, no matter what kind of comes my way? And that's always a good strategy. Even if the world is wonderful and things are going well, a lot of times I meet with people in psychotherapy and we just say, how do we keep things going well? How do we keep you functioning positively? So, thinking about preparing ourselves for things that might happen really boils down to the basics, taking good care of yourself, remembering your resilience and your strength, trying to keep a positive frame when you possibly can, but yet feeling okay when you feel like kind of miserable, and reaching out to others and understanding they feel the same way too. Engaging in positive self-care through good exercise and, mindfulness, eating, taking breaks from media, taking breaks from people who are demanding too much, just taking breaks whenever we can is always a good thing. So again, not sort of anticipating the worst to come, but building up our strength so that if more challenges are on the horizon, we have enough left over to deal with those things when they do come.
Yeah, great reminder. So we're just about out of time. Is there anything that you'd like to leave our audience with today, Stacey?
I am just, really, I see people every single day in my work who I'm amazed at their strength and their resilience and really their generosity and kindness to others as well. And I think right now, that's something that we also need to remember is compassion toward ourselves and toward everyone else. We don't always see eye to eye, and there's, times when we're not going to agree with other people, but remembering that working together and shouldering the burden together is so much easier than shouldering it on our own. So I encourage people to remember that compassion.
That's a great reminder. So thank you for sharing that and all of your other expertise with us today.
Thank you so much for letting me be here.
Of course. And thank you to everyone who tuned in. If you joined us after we started, or if you're rewatching this, make sure you go back to the beginning and watch all 3 minutes of the presentation so you can get all the great information Stacey provided us today. And as you continue taking precautions to prevent the spread of COVID-19, please remember to also take care of your mental health. Make time to relax, cope with stress, and enjoy whatever it is that makes you happy. Thank you for watching.